everyone, welcome to the next session of parenting. I would like to take breastfeeding, which is a very important step in baby's nutrition as well as taking care of baby. Breastfeeding is a very knitted topic to me, a close topic to my heart, because I had done my doctorate in nursing on this particular topic, the importance of antenatal counseling and breast growth. I would like to explain it later, and the impact of this on the babies for the first 6 months, so that how their growth and their development, not only neurological development, other kind of development can be improved, studied by me. So when I started with my PhD topic, I did not have children. In the middle of my education, I got conceived. The topic is too much into me because of the passion I have done this. I breastfed my children for 4 years. So here comes the topics of breastfeeding. So if you speak about the breastfeeding, how much ever we are speaking, the public is giving importance, advertisement are giving, we need to understand that globally and nationally, the rates of breastfeeding are very less in women, and children are affecting, or the kids are affecting, because the health of the baby is affected, or their death rate are more. So first thing we need to understand that a mother need to be counseled and made her understand the importance of breastfeeding once the baby comes out from the very early time period, that is from the 6 months of pregnancy or 7 months of pregnancy. We need to teach them what is the importance, how you can breastfeed the baby, how you can take care if any complication has come up. So that part has been taken care. Once the baby comes to the mother is really able to handle the baby better than a mama who's not taught before how to take care of the baby. So the first thing we need to understand is the initiation of breastfeeding. The main 2 points that help for a successful breastfeeding is early initiation of breastfeeding and exclusive breastfeeding. Early initiation of breastfeeding means as soon as the baby is out from the womb, the earlier you are keeping the baby on the breast will help the baby to suck the breast and having more amount of milk. The second thing is exclusive breastfeeding is you cannot give anything else other than the breastfeed of a mother to a baby for first 6 months, because this is very mandatory. How much of a theory we are speaking, it's very difficult to convince people the importance of this. I have followed this, that's why I know the importance of what I'm speaking. So the first thing is early initiation of breastfeeding. So in order to start the breastfeeding immediately, we need to understand that hospital play an important role, because once the baby needs to come out and whatever procedure need to be, delivery room needs to be done, that need to be taken care, they need to shift it to another room, then the family involvement is there. So in order to avoid this hindrance, what we can do is once the baby is born, the baby can be immediately kept on mother's abdomen or tummy, so that the baby has his or her own instincts. With the help of this instinct's nature, he or she is able to crawl to the breast. This is known as breast crawl, because with the vision, the baby doesn't have clear vision. Whatever vision the baby is having, the baby is able to identify the nipple, and the baby is able to make movements which is similar to a crawl, and the baby can crawl to the breast of the mother and can start the breastfeeding immediately. So this really helps for early initiation of breastfeeding. I encourage every mothers to ask your obstetrician or the gynecologist regarding the same. Is there a facility you prefer to have this, because it really helps you on the first step of breastfeeding. So the second thing is 6 months of breastfeeding, that you should not give them anything other than breast milk. And we can see that the mothers always say give them water, they are dehydrated, they need more water. Please understand that 90% of the breast milk is water that quenches the thirst of the baby. Another point what we need to understand even in the antenatal period is that there are something called galactagogues. The food items or the medicines are there, but we mainly talk about food items that can increase the breast milk supply. So you know about fenugreek seeds, fenugreek leaf, and every product of fenugreek is good for increased milk production. Another thing is garlic and increased amount of fluids, ajwain, all these things helps to have more amount of breast milk along with that sprouted cereals, really, sprouted pulses has really helped to increase the milk supply. So in the food item, it's good from the 7th 8th month onwards you include this food item, so that it helps for the early initiation and increase breast milk, so that the baby can having adequate milk. The next point, we need to understand that the positions of breastfeeding. So if you see, there are different positions can be given. Once the mother has undergone a normal delivery, the mother can come to a sitting position immediately. How much ever painful it is helpful for the mother to regain to the normal life. So what they need to do is, that's why the position is taken like this. Once the mother when the baby has come up, what the mother can do is, the mother can sit up position. The important thing what we need to understand, that whenever the mother is breastfeeding a child, any position, the back of the mother need to be well supported, because this trains the back of the mother. And this is not for a minute or not for an hour, it is for years we need to follow the breastfeeding, because this really put you trouble with the back. But if your back, if you know how to maintain your position for breastfeeding, this is the best thing what you can understand is, take a chair or the bed wherever you are sitting, take the board of the bed, you can keep a pillow behind yourself and keep yourself straight. And before starting with the breastfeeding, it is always good to wash your face, have a glass of milk, have a glass of juice, so that you are hydrating yourself before you're giving milk to the baby. So once you are having the baby, what you can do is, always keep a pillow next to you, so that we can keep the baby on the pillow. So once the baby is on the pillow, there is no need of carrying the baby in the hands, which is heavy after a minute or two. So what you can do is keep the baby on a pillow, and with the help of pillow you are able to keep the baby on the breast of the mother. Second point, we need to understand that the latching, that is how well the baby is latching on the breast. We need to understand that not only the nipple should go inside the mouth of a baby, the entire black portion which is called areola of the breast need to go. It makes a teeth and it should go inside, so that the baby have a good hold. This will help you to prevent sore nipples or the skin breakage of your nipples, which is very painful, and that is a main reason that mothers are stopping the breastfeeding. So one thing you need to understand, keep yourself relaxed, have a glass of juice, position yourself with back well supported, keep a pillow on your lap, keep the baby on this pillow and position yourself, and make sure that along with the nipple, the areola, that the darker portion of the breast also go inside the mouth of the baby, so that the baby is able to suck it well or hold it or attach it well. Okay, and once the baby is sucking on your breast, it's always good that you feed both the breasts at a time. If you're starting with your left breast first time, you are feeding for 10 minutes and start with the next breast too, because there is something called foremilk and hindmilk. Foremilk is more of liquid or more of water, which can quench the thirst, that can take out the hunger of the baby, but the milk that is behind is known as hind milk, can contain more kind of proteins and all the nutrients, immunoglobulins and all. So it's always good to breastfeed on both sides at a time. And the second time when you start from the last breath where you stop the breastfeeding. Now the point is, every second hourly you are supposed to breastfeed the babies in the initial period. Other than that, the baby gives you the clue that the baby is hungry. So at that time, demand feeding is very important, so that you can breastfeed the baby whenever the baby is crying. Now the point, we need to understand that indicators of adequate breastfeeding. That is, how do you know that the baby is having adequate breast milk? In that, the first thing is, once the baby attach your breast, you are able to understand that the baby's swallowing sound can be heard by the mother. Okay. Second thing is, the milk is going from your breast. That kind of feeling you are able to understand. And the third thing is, the baby passes urine. You can change 6 to 8 nappies in 24 hours, which again shows that the baby is having adequate water. Even bowel movements will be there. That these all things shows that the baby is having adequate breast milk. And the other point what we need to understand, that the baby is having a weight gain of 18 to 30 grams per day, which shows that the baby is actually getting nourished every now and then. So these are some of the clues as a mother to understand that you are having adequate milk. Another perception of mothers that I don't have adequate milk is the reason for stopping the milk. So this is the important tips we can understand and identify the baby is having adequate milk. Okay. The next thing is, once the breastfeeding over, so I already said about this sitting position. Actually, you can have it in a lying down position, but most of the doctors avoid that thing. But what we can do is we can keep the hand in such a way that the baby's head is uplifted, not only neck, the head and the upper part of your back is uplifted, so that there won't be any aspiration of milk while the baby is having. So that we need to be careful. Why sitting position is always preferring? Because that avoid the chance of aspiration in the baby. In case of twins like me, what we can do is we can take two pillows on both sides, and both the babies can be kept on the pillows, and you can keep the babies towards your breast and you can breastfeed the baby. Initially you need the help, and babies, as babies are growing big, they are more smarter. Once you show them, once you make them close, they will click to the breast and they will start breastfeeding by themselves. Two more points I would like to talk about breastfeeding is, first is burping of the baby. Burping means when we also eat food, we are advised not to lie down immediately because it can produce gas. Same way, the breastfeeding is not an easy task for a baby. So what they will do, while they suck the breast, more air is going inside. So while you are burping the baby, the excess air what is in the stomach is taken out. So the common position what we use is, we'll keep the baby on the hand. The main thing when you're managing a newborn, we need to understand that the head is not supported. So the head, neck and back should be supported whenever you're taking a baby. Keep it in upright position. And we always, our mothers, everyone will teach you, when the baby makes a sound, it's done. But it's always good to burp the baby for 20 minutes. So with sound and without sound also gas can be passed. Another thing is hiccups in newborn babies. This is the reason, that is because of improper burping, the hiccups can happen. So whenever hiccups are coming for a newborn baby or any babies, burp the baby for some time, the hiccups will go by itself. The next point I would like to highlight on breastfeeding is expression of breast milk. So we need to understand that there is no need to wash the breast all the time. Take a bath, proper bath first time, that itself is more than enough. There is no need to do any extra care on the breast. That's more than enough for the breast, because whatever the enzymes are produced over there, that is good for the lactation of the mother, and that's actually soothes the skin of the breast. So there is no need of again washing with soap and water. Once you are taking a white mouth plate or a bowl, what you need to do is, after having a glass of water, keeping yourself relaxed, keep your position aligned, that is a straight position with a pillow behind, and what you can do is you can massage your breast. Once you massage your breast, what you're doing is you are touching or you're stimulating all the tubercles over there in the breast, so that it is stimulated and you are making it straight, so that you can pressing it out. And we already know that breast pumps are available, manual breast pumps and electronic breast pumps are also available, which will help you to express the breast milk. Okay, so the next point, or the last point I want to cover, is the storage of breast milk, which is not known by most of the mothers. We need to understand that once you are expressing the breast milk, that you need to go out. There is no need to start the powder milk or infant formula for the babies. You can express the breast milk and in a clean, sterile container, and you can keep it in the room temperature, that is a normal temperature, for 6 to 8 hours. You just need to cover it up. There is no need to do anything for first 6 to 8 hours. You can feed the baby with the bowl and the spoon, which is sterile. That we need to make sure that it is sterile. Other again, the baby will end up in other infectious disease. If the mother is out for a day, you can keep this milk in refrigerator for 24 hours, and if in the deep freezer, another 2 more days you can use. So once you are using the milk what is there in the fridge, what you can do is keep it out for some time till when the breast milk comes to a normal temperature, then feed the baby. There is no need to warm the breast milk. Hope this session will be helpful for you. If you have any doubts, you are always encouraged to mail me and ask me doubts. The complications of breastfeeding are also very important to be dealt. I would like to explain those who have doubts on the same. Thank you so much. See you on the next session.